Good afternoon, everyone, and thank you for attending this embargoed virtual press briefing on the critical role of social protection in developing countries in the context of the COVID-19 crisis and beyond. My name is Rosalind Yard and I'm Chief of News and Media at the ILO. With us today are Shahra Razavi, Director of the ILO Social Protection Department, who's joining us from New York, Christina Bechrand, Head of the Social Policy Unit of the Social Protection Department at ILO HQ, Nuno Cunha, Senior Technical Specialist on Social Protection based in Bangkok, Thailand, Ruben Vicente Andres, Social Protection Program Manager based in Maputo, Mozambique, Helmut Schwarzer, Specialist in Social Protection and Economic Development based in Mexico City, Mexico, and Divya Verma, Program Officer in our New Delhi office, India. You'll find their names in the media advisory we sent you yesterday. You should also have received the press release and background documents. Please make sure that your media outlet is added to your names in the participants list. All journalists' mics will be muted and controlled by our technician. Raise the hand icon to indicate that you have a question, and we will go down the list, unmute your mic, and give you the floor. We'll take one question at a time, and if you have a follow-on question, please include it with your original question. Regional journalists who are watching this on our YouTube live stream link can send questions to newsroom@ilo.org. We'll answer these as soon as possible after the briefing. And just a reminder that this is an embargoed press briefing. The embargo will lift today at 1500 Geneva time, 1300 GMT. Shahra Razavi, Director of ILO's Social Protection Department, will now begin the briefing with a short overview of the issue. Then we'll open up the floor to questions. Shahra, please go ahead.
Thank you, Rosalind. Good morning, colleagues in Geneva. Good day, colleagues elsewhere. Allow me to give you a very brief introduction to the themes of today's briefing on the role of social protection systems in developing countries. Now, we have before us a rather devastating situation where we've seen the economic and social fallouts from the COVID-19 crisis in many countries around the world in the absence of social protection systems that are inclusive, universal, and adequate. Now, we know very well this virus does not discriminate between the rich and the poor. Princes and paupers are all equally affected, yet the actual impacts of the virus on economies and societies and on people is anything but equal. And this is of grave concern. Those who are better off have secure formal sector jobs, are able to rely on robust social protection systems, have access to healthcare, and are able to protect themselves and quarantine themselves while continuing to work, have obviously been in a much stronger position to withstand this particular shock compared to others who are not equipped with any of these resources. There is no level playing field when it comes to access to healthcare. We know from our available statistics that almost 40% of the world's population is not affiliated to a health coverage scheme, by which we mean having access to social health insurance or being in a country where you have a strong public health system. And these people have to resort to regressive out-of-pocket payments to access healthcare, which is a very slippery slope that pushes many people into poverty. And given the prospect of that slippery slope, many people avoid going to seek healthcare. Which is obviously a devastating impact for them and their families and their communities, particularly in the context of a contagious disease like COVID-19. Now, with the measures that have been put in place to contend the spread of the virus, what really started as a health pandemic has very quickly morphed into an economic disaster, a recession on a scale which we have not seen since the Second World War. And as the ILO's monitor shows very clearly, there's hundreds and thousands of jobs that are now in peril all around the world. And yet, and this comes to, again, the centrality of having robust social protection systems, In the midst of this economic turmoil, only 1 in 5 people who are unemployed can actually rely and count on unemployment benefits. That's a very small proportion. As the crisis is unleashed on developing countries, which is really the focus of today's briefing, where the bulk of the working population is in the informal economy, by which we mean people who don't have social protection coverage, guaranteeing income security to them and effective access to healthcare has become a formidable challenge for governments around the world, both financially and administratively. And we will be saying more about this, and my colleagues will be giving you some specific country examples of this particular challenge. Now, ensuring an adequate emergency response and developing a longer-term strategy to get us out of this crisis and to help us withstand future shocks, strengthening social protection systems and crisis preparedness in developing countries is an absolute must and has to rely on a number of really important measures, which I'm just going to highlight 3 of these now to be more concise. The first priority, obviously, is to guarantee access to quality healthcare by mobilizing additional public funds to boost healthcare budgets as part of this emergency response. And many governments are doing that, sometimes by shifting resources from other areas into public health systems. But beyond the crisis, and after almost a decade of austerity that has seen years of underinvestments in public health systems, it is absolutely critical that countries safeguard and extend the coverage of social health protection mechanisms, such as social health insurance or national health systems. So this is a really important and primary area of focus. And in parallel, no less important, is the need to ensure income security for everyone. No income, no food. It's as simple as that. And we are really seeing the impacts of that, particularly in developing countries, but not just in developing countries, as families struggle to put food on the family table, especially in the context of rising food prices and shocks to food security, affecting those who are not even often considered to be among the poor. And here we really would like to draw attention to the role of non-contributory cash transfers, i.e. transfers that are financed by the general revenues that governments have from taxation and other resources. Now, in some countries, these have to be put in place from scratch because such programs have not been in place. And that is a formidable challenge. But in many others, there have been such programs in place, and therefore government's tasks is relatively easier, having to sometimes increase the level of benefit that these cash transfers provide, extend their coverage to a larger number of people, to a broader group of people, and also make it easier for people to access it. And that's another important challenge. Social insurance systems also play a really important role, particularly in countries where they cover a relatively significant part of the labor force, in giving people adequate protection. And also in some countries, efforts are being made to extend the coverage of the social insurance system to groups, to workers who have not been so far included under their coverage. In the briefs that you would have seen, we're paying particular attention to workers in the informal economy who are not yet covered through these kind of contributory, i.e. classical social security systems and mechanisms. Several countries are, in fact, as my colleagues will also be talking about, pursuing rather innovative policies in this context of crisis to reach these informal workers quickly by having a combination of the non-contributory cash transfers as well as these contributory schemes, which also has the long-term advantage of bringing a larger number of workers in the informal economy into the formal sector, thereby formalizing informal work, which has been obviously a major goal and preoccupation of the ILO and of many countries. Now, in a crisis as deep and extensive as the present one, the urgency of protecting incomes and jobs is obviously paramount, and governments need to use all the instruments at their disposal to support workers and enterprises, particularly small and medium-sized enterprises that are really struggling. whether they are using unemployment protection schemes, wage subsidies, or putting in place public employment guarantee schemes. Also, we have a specific brief on sickness benefits, which have also been brought into sharp relief in the context of this pandemic. As we know, a lack of coverage for sickness benefits encourages people to keep on working even when they're sick, at the risk of their own health, as well as the risk of spreading the disease to others in the community. And I think the current crisis really does highlight the importance of sickness benefits and the need and urgency of making sure that short-term measures to close coverage and adequacy gaps in sickness benefits are being effectively addressed. Now, let me end on a really important point that has been for media, it's been in the headlines. And that is, of course, the whole issue of the fiscal resources needed to make these systems, social protection systems, work and cover everyone. The need for fiscal space to be able to tackle this crisis effectively is something that all countries are struggling with. Developed countries are clearly in a much stronger position to provide the kind of fiscal outlays that are needed. And we've seen numbers being cited of countries putting in place big stimulus measures and expanding their health and social protection systems. For developing countries, really the challenges are much larger. As they're facing unprecedented demands on their public fiscal resources, at the same time that they're also facing a major capital outflows, as well as very sharp declines in the revenues they had from exports, from tourism, from remittances coming from migrants. So it's a really difficult bind that they're in this context. And while many developing countries have been able to strengthen domestic resource mobilization by strengthening their tax systems, although much more remains to be done, there is in this context a really urgent need for the international community to step in through immediate changes that will enable quick increases in resources. And there has been, thankfully, quite an extensive discussion about debt moratoriums that can free developing countries from having to pay huge interest payments, as well as paying back these debts, as well as demands for the IMF to issue much larger shares of special drawing rights that can provide resources to developing countries. Now, let me end on a note of on a rallying cry, really. The examples from around the world that the briefs we have before us, and my colleagues will be giving you very concrete examples of, show that countries are mobilized, governments are active, and they are making every effort to put in place social protection measures to really save the day in this emergency. But the crisis also demonstrates once again that countries that have these systems in place, comprehensive, robust social protection systems, are in a much stronger position to react strongly, effectively, and quickly in the context of a crisis. Whereas those who don't have to really make systems do on the run, which is a formidable challenge. Now, the call that has been issued by the UNSG as well to build back better is an important one. And we need to really use the momentum that has been created by this crisis, and also the huge public demand and sense of urgency that people feel that it's a priority for countries to invest in social protection systems, to invest their resources in public health systems. This is a very palpable demand that people have. Governments need to use this momentum and to build on this momentum to make rapid progress towards collectively financed, comprehensive, universal social protection systems, to which already they unanimously pledged in 2012 when they adopted the ILO social protection floors recommendation. It's really high time that they act on that promise. If the pandemic has a silver lining, one hopes that it will spur governments and societies to mobilize for that kind of action, to make good on their promises, because that's something that we will really need in order to be able to be better prepared for the existential threats that we know are coming and are down the line from the climate-related shocks and crisis. Thank you very much.
Thank you, Shahla. We'll now open the floor to journalists. So please raise your hand using the blue hand, and then we'll put your questions to our panel. Okay, so we have the first question from Laurent Sierro from Swiss News Agency. Laurent, please ask your question.
Can you hear me?
Yes, we can hear you, Laurent.
Very good. Thank you for the briefing. I was wondering whether we have an idea of the costs for the governments and the public authorities to implement, to fill the gap in terms of, for instance, sickness financial benefits. How much would that cost to the government to be able to tackle that issue, and more broadly to the gap of social protection as well? Thank you.
Rosalind, would you like me to respond
to
that question quickly?
Yes, go ahead, Shaka. Yes.
Yeah, based on the estimations, thank you very much, Laurent, for that question. Based on the estimations that the ILO Social Protection Department did in 2019, the financing gap stood at $527 billion per annum. Now, you would have seen that the IMF, the World Bank, many other development banks have already made quite significant pledges to be producing and providing the kind of resources that are needed, something like $1.35 trillion of which $1 trillion is to come from the IMF. But so far, the figures that we have indicate that something like 160 billion also have been committed from the World Bank. But of the pledges that have been made so far, only around 32 billion seem to have been coming forth. And of those, about 17 billion have already been allocated. So we have a huge gap that remains. I think that's the short answer to your question. Maybe other colleagues would like to add more.
I think Laurent has a follow-up question.
So that figure is for social protection, or is it, and what about sickness financial benefits that are lacking?
Yeah, that figures, the 2019 calculations are for social protection benefits. The calculation did not even include social health coverage. And we are currently in the Social Protection Department making new calculations in the context of the COVID crisis, and including calculations for universal social health coverage. And we will hopefully have the numbers ready by mid-June, and we hope that we can have another briefing at that point with the most up-to-date figures that we have. Thank you.
Okay, the next question is from Gabriela Sotomayor.
Hi, thank you very much. Do you hear me?
Yes, we hear you, Gabriela.
Thank you very much for taking my question. I'm a Mexican journalist for Revista Proceso. I would like to know about countries like Mexico. In Mexico, more than 50% is an informal economy. There's no social protection, no health protection, and a government that is not supporting middle and small businesses. So what is the perspective in this scenario? Is this a perfect storm for a disaster or something like that? I mean, millions of people are going to be in the very, very dark side. What can you say?
Thanks, Gabriela. I think this is one for Helmut.
So many thanks, Gabriela, for this question. It is true that Mexico has a high informality rate. It is about 56% of the working population, and this reflects on a relatively low coverage in comparison to other countries in Latin America. Of the contributory systems. We have in the World Social Protection Report, we have a figure of about 50% of the Mexican population that would have access to a social protection benefit at that time, to 2017, when the report was issued. So since then, over the last years, some reforms have been enacted here in Mexico, which we see as positive. They solve part of the problems. For example, there was the extension of benefits, universal old age pensions to 8.5 million people approximately. These benefits have been anticipated now in this crisis, so payments have been anticipated. Then there was a creation of 1 million benefits for disabled people financed by taxes. And we see that under the current health crisis, the different subsystems, because the Mexican health system is quite fragmented into different subsystems, but there has been an increase in the level of coordination, at least in those areas where the health indicators have been increasing and have been worse. For example, here in the Valley of Mexico. So the social security, the contributory social security health assistance has been coordinated with a public tax-financed health system, and also with the private offer, the private hospitals and private medical services. So maybe this could be again in future for Mexico to have a higher level of coordination among different health assistance systems, so that we can at the end of this crisis have an improved level of coordination of different social protection systems. The most important gap we see here in the case of Mexico is the lack of an unemployment insurance, of unemployment benefits. This is something which we have already seen in the 2008 crisis, 2008-2009 crisis. And most recently, when there were the two big earthquakes in 2017, one in the south of Mexico, the other one in the center of Mexico in the month of September, when an important number of people lost their jobs or had an impact on their incomes. And there were actually no meaningful social unemployment benefits in place. The exception here in Mexico in terms of unemployment benefits is the city of Mexico. So it is a state level unemployment benefit scheme, which has been quickly reformed in the recent weeks, so that it could extend the coverage to a larger number of people. It's financed out of taxes, but as Shara said, there are also fiscal restrictions to maybe to extend it as much as it could be possible. And there is another example. The state of Yucatan has recently introduced unemployment benefits and cash transfers to unemployed people, which come from the informal sector. So both states, state of Mexico, the city of Mexico and the state of Yucatan, kind of show the way. And we hope that as a positive result of the current crisis, that Mexico may finally introduce unemployment benefits for people who are both in the formal and in the informal sector. And this is really the major gap which we see here in the current social protection reaction. And as you said, it is crucial for people from the who lose the job to have a guarantee of their income.
Thank you, Helmut. Thank you. We'll go on to the next question, which is from Kyodo News. Please ask your question.
Yes, thank you very much. Regarding the socio-economic impacts of the COVID crisis, we always talk about the structural factors, meaning that these issues like social protection that were here before not tackled, and now we see that the crisis is exacerbated by what we have not done in the past, or not quickly enough. So I just had a question, taking a step back. I mean, we talk today about different models of states, meaning the Chinese model, the Western model, others. But there is also different models inside developed countries, meaning the West. And I was wondering whether you see, or you can comment, something that I have realized myself, is that, of course, we had this conservative revolution in Western Europe in the early 1980s with Thatcher, with Reagan, the state basically going back, the market taking the lead, etc., etc. In other words, moving away from the welfare state. And I was wondering whether we see today the failure of this conservative revolution, meaning that countries, let's say in Northern Europe, like Denmark, Sweden, who have sticked to the welfare state model, are basically performing better today than countries like the UK or the US. Thank you.
Maybe I'll have a go at that and then ask colleagues to come in. Maybe Christina would also like to come in on this question. I think, there's quite an extensive literature, obviously, on the varieties of welfare regimes in the so-called developed world. And we have had welfare states, welfare regimes that have been more universal, more generous, others that have been more the sort of liberal welfare states, if you like, that have had stronger market provision, more residualist welfare, often strong social assistance, targeted measures. And I think in many different countries, the kind of inequalities and deficiencies that we have seen in the welfare states over the years, the welfare regimes, have, as you say, come out and been exposed in the context of the crisis. And the experience when you compare some of the responses in Northern Europe have been perhaps in some ways more robust, and the underlying inequalities that exist in these societies have also, in all societies, have been exposed. And I think whether in some cases, we have seen increasing inequalities in terms of not only class, but also in terms of, ethnicity, race. Those inequalities, unfortunately, have also come out quite strongly in this crisis. And perhaps the retreat from stronger public provision, stronger welfare states that are more universalist or lean on universalism will be, hopefully, that will be seen as a way to go post-crisis, and there will be a strengthening of the comprehensiveness and universality of welfare regimes in many different regions. That I think at least is the hope, because as you say, some of the gaps and the inequalities have been painfully exposed in the current crisis. But maybe other colleagues would like to come in on this question as well.
Yep, from an Asian perspective, I think this is a very important and relevant discussion in this region. We have been observing that, of course, and you all follow the discussion on the East Asian tigers, a model that is based in a small state, and a model that somehow has been seen for many as a success. But actually, it's during crisis. It was during the 1997 crisis, in 2008 again, and now even more visible. The problems of this model, we are talking, and we talk about maybe the engine of the world, but it's shocking that 61% of the population living in Asian Pacific has absolutely no social protection. Or if we look at unemployment insurance, only 25% of workers, when losing their jobs, have any sort of income protection. And this is basically this model. You keep a small state, you indeed move the economy, and the economy shows some success. You look at the growth rates for many years, but this is not translated in a model that is sustained. And every crisis is not only about people that are suffering during the crisis, but it's also about the sustainability of this model in itself from an economic perspective. And what we saw, for instance, we did some analysis and some work in China recently with some universities, and we were looking actually at the role of social protection more from the economic perspective, what the lessons of the last crisis and the investment in universal social protection like pensions or health were not only a way of dealing with workers' vulnerabilities, but also on increasing the role of domestic consumption. And this is a discussion we have in plenty of countries. I think that's probably the way of integrating this discussion actually in the big picture. And I think it's very good that you brought it. And for sure, what we see these days is that all these gaps, all this discussion that usually we have at closed doors between researchers, universities, they became part of the public discussion. And I think this is a very important element. Those who are usually invisible, we talk often, like as ILO in the countries, we talk with ministers, with deputy ministers, and we mentioned informal workers, but many times it's hard to understand what it means. But these days, suddenly, with the crisis, they became visible. When you go in the street and you see the tuk-tuk drivers waiting because there's basically no tourists in Bangkok, and the government felt obliged to put specific measures because all the measures, and Thailand is probably one of the best systems in the region, but all the systems that they have in place was just leaving all this group behind. And I think that's the positive message in terms of the crisis. Let's hope we don't forget quick as it happened in 2008, and let's hope this keeps. But actually we see most of the developments, they didn't come back, like universal health protection in Thailand, universal pension in China, or they didn't come back after the crisis. And we hope, and we think this needs to be the message. We need to take measures to protect us not only for this, but for future crises. Thank you very much.
I think Christina wants to add something. Christina Berendt.
Yes, yeah. Maybe just to add what Shara and Nuno have explained. Indeed, I mean, it is really the case that the inequalities and the lack of protection for many categories of the population that were there beforehand, but which were quite often put aside. I mean, for example, and I think this is true in both developed and developing countries, looking at the situation of the self-employed, where we see extreme social protection gaps. Looking at the situation of categories of workers who are part-time workers who are working without a contract, workers in temporary employment. There are a lot of workers in societies all over the world which have been have lacked adequate protection beforehand, and quite often it was pushed aside and just kind of pushed over to say, well, I mean, they should be happy to have work at all. But I think now with the crisis, I think it's clear that this is not sufficient. And we see indeed, as you have alluded to in your question, that those countries who have better systems in place which provide more universal protection, they have been able to step up the protection more easily than countries which didn't have that in place. But I think even for those countries, I think the crisis now really provides a wake-up call to see what can we do to put in place these measures immediately, but also what can we do to really make sure that they are going to stay after the immediate effects of the crisis are over. And I think this is really an important wake-up call in that sense. And this is really the case for countries all over the world.
Yeah, and maybe if I can just wrap up, I think this really interesting discussion that is going around by saying that, it's also a really important lesson to be taken from this is to really see money and resources that go into building social protection systems. This is not just expenditure, it is an investment. And when we think from a macroeconomic perspective, when money is going into infrastructure, hard infrastructure, bridges and dams and whatever, is seen as investment, and it's treated differently from a macroeconomic perspective. You can have deficit financing if you're investing in bridges and roads, but social protection systems is seen as kind of an expenditure, not an investment. And I think these kind of crises reveal very clearly the fact that actually money spent in building a social protection system, that's also a very important social infrastructure that pays off. And so I think we really need to revise even the macroeconomic categories and see money and resources going into building healthcare systems, building social protection systems as an investment, something that societies need to prioritize and put their resources to during good times so that they can stand stronger when the crises come and difficulties arise.
Thank you, Shaka. Thank you. Do we have any other questions from the journalists? Okay, Kyodo News, you have a follow-up. Go ahead.
Yes, thank you. Well, to follow up, very interesting answers. Thank you. I'm not an economist at all, so it's good to talk to you. I'm more a political scientist. So following up on that, I mean, to expand social protection, and I guess I agree with you that this is an investment and not an expenditure, but you need money. And I mean, looking at, for example, let's stick to developed countries. We have national debt in some countries like Japan, who are at 130% of their GDP. I mean, is it not too late and to invest? I mean, the financial system globally is in bad shape. I mean, it will be very difficult to convince countries, yes, you have now to invest in social protection, which is an investment, but in the long term. We may see the same tendency as after the 1990s economic crisis in Asia, or 2008 economic crisis in the Western world, with countries rapidly forgetting, as you say, the lessons. And therefore, I was wondering whether there is no possibility to somehow privatize social protection. Has it been done? Meaning that it's not the public or the government that actually is only engaged in providing public services or social services, but also engaging private companies and marketizing social protection. Has it been done? Is it a solution?
Yeah, which one of you would like to take that question?
Yeah, maybe I've been talking too much. Other colleagues can have a go at that, but I'm happy to maybe just have a go at it.
Yeah, you start, and then maybe one.
Should I just start, and then I'll say very little. I mean, I think in fact we do have a lot of experiments with that privatization model, and it is, you know, it hasn't gone according to the books. We have had a lot of public-private investment, you know, partnerships, so-called public-private partnerships in the developing world. Quite a lot of that in terms of provision of infrastructure, of water, for example. And unfortunately, you know, one of the problems with the kind of public-private systems has been precisely that investments go where there is a payoff. So you've seen in public-private partnerships in the area of water provision, for example, a lot of the investment has gone in areas where there are populations who can pay the kind of rates on use of water. Therefore, in some parts of Africa, you know, it's the remote villages, hard to reach villages that require incredibly high investments. That's where the capital is not going. And that really has been one of the lessons that has come from that, because populations in those areas are not able to pay the kind of user fees that would make that investment profitable. So there is certainly a role for private provision under good government regulation, but the kind of private-public partnerships that have existed in some areas, at least, as I said, in water privatization or others, have not really been able to provide the kind of universal coverage of which you know, we're talking about, and which is really the necessity in order to make societies much safer and much more robust. So I'll just leave it there and ask colleagues to come in and complement that.
If you allow me, Shara, in the case of Latin America, we have a number of countries that have adopted varying mixes of public-private arrangements in terms of social protection systems. Some countries have fully privatized. The case of Chile. The case of Mexico has privatized pensions in the end of 1990s. El Salvador, Dominican Republic, Peru, Colombia, Argentina have introduced mixed schemes in terms of pensions. There are countries which have privatized partially or integrally their health assistance systems, and then they needed to come back to to subsidize and to recreate public basic provision. Well, there is a study which has been released by the ILO in 2017 on the results of private pension schemes in 30 countries of the world. And in 18 of those countries, the privatization had been reversed, at least in part, because the private schemes had not really delivered what had been promised. Maybe if we did the same study about health systems, health privatizations, we would have similar results, because as Shara said, the private companies they are guided by the interest of earning money for their investments, and not necessarily by the goal of extending coverage and of improving the benefits to all they usually tend to create a segmented quality in terms of services. Quite often this fragmentation has shown to be very expensive in terms of administration costs, in some cases transition costs, because you need to pay for the benefits of the old schemes that have been closed. So the transition costs are an additional burden on the possibility of the country to invest in extending social protection coverage. So there are many, let's say, challenges which have to be taken into account. It's not just a, let's say, a simple comparison of this system more efficient than the other one. In Latin America, though, most countries have had the lesson that those who privatized needed to come back with public provision, at least in a first pillar, and then transform private benefits into a supplementary pillar of the public pillar that provides health care, or the public subsidies that extend coverage of health to those who are not able to pay for the private sector costs. And now in this COVID crisis here in Latin America, we see that actually the public universal systems, or those with a universal vocation, have had a stronger reaction, or have had a, let's say, the capacity to better react to the challenges than those which have been privatized. I will not talk about possible financial market losses of the investments of private pension funds. I'm not going to talk about that, but I would refer maybe to the examples of the basic health, the universal or basic health systems. We have the case of Costa Rica here in Latin America, which is a small country, but that has chosen in the late 1940s to strengthen the social security system and make the social security system after the civil war of Costa Rica and of the 1940s. The social security became the linking element, so the social cohesion element of the country, and it had been a value of Costa Rica since then for decades to make efforts to universalize coverage, and now in this crisis, the Caja Costarricense de Seguro Social has taken the responsibility for providing health attention to all people, regardless of if they have or not contributed in the past, and then the Caja Costarricense will be reimbursed by the Treasury and by the National Insurance Institute that is responsible for collecting funds for other people who are not insured in the Caja Costarricense. Or in the case of Brazil, the universal health system, which stems from the 1990s, when the Brazilian constitution was reformed in the late 1980s, and then in the early 1990s, a universal health system was introduced. This universal health system, despite the difficult situation the country is now facing in terms of COVID cases, it is what helps the country to resist. In Argentina, we have a strong social security institution. ANSES is the national administration of social security in Argentina, and they have been capable of quickly extending benefits to all families in need. Argentina has introduced a simple universal benefit to all people based on the family benefit scheme of ANSES, which has a good roster, a good database which can quickly use the payment channels and which can quickly extend coverage to those who still lack receiving the benefit. Or even here in the case of Mexico, the health system, there was a reform late last year in terms of the coordination of the health system. The Seguro Popular, which was a scheme introduced in the early 2000s, rather focalized on the poorest population, was replaced by a coordination of the different public schemes in states and at federal level, and this goal of extending, of universalizing coverage, now this scheme which has just started operating, so it is very recent, this reform. It helps coordinating somewhat better the different subsystems or the different fragments of the health system in Mexico. So we have here a number of cases in Latin America which show that a public coordination and a public pillar, be it in health, be it in monetary benefits, is absolutely essential, and is what actually helps these countries to resist to the challenges which they are facing under the COVID crisis. And that there is a place for private benefits which is supplementary to this public pillar. This is maybe one of the key lessons here in the case of Latin America. Back to you, Shara.
If I might add, I mean, it's very interesting the way you place this question. I think it's something, and consistently with what I said before, I mean, the economic model here, it's not very rare for me to be on discussions where actually the point that is brought to the table is, should we not make this private as a way of solving our problems? But what the crisis actually is showing us is that is much more often to see now the private asking help from the public than the way around. And this is, I think, it's when we look at one of the measures that Shara mentioned in the beginning, when we talk about wage subsidies is not, it's when you pick what exists in terms of unemployment insurance that is designed actually to support the workers when they lose their jobs. And here on wage subsidies, we are talking about supporting the enterprises to pay salaries, to deal with their own costs. I mean, it's the public that is basically replacing the function of the private, even in the business sector. And I think even me, I've been talking with neighbors who are investors in Thailand, who have their companies, and for them this has been essential. This has been the only way to keep alive. Then I think when we look, especially under a situation like a crisis, when we look, for instance, what happened in 2008, and we saw the bailout of banks, is usually it's the public that will come to the rescue of the private. And I think that's good that you brought it, but at the same time makes me think even more strongly that the private provision in terms of social protection is not probably the best solution. Yep, and that's all. I mean, I just had that to add.
Yeah, and thank you. I just wanted to add a couple of two really small points. One, just on the discussion of pension privatization, we are looking forward very much to a roundtable that we're going to be hosting at the ILO with 13 governments and 13 of our social partners, both unions and employers organizations, to have a really productive discussion, hopefully, on this whole experience of privatization of pensions, and to have some useful takeaways for us to take away from that in terms of lessons learned moving forward. So we're really looking forward to that discussion. Secondly, I think on the role of the public, the private, state market. I mean, this is, I think a lot of what has been said, I kind of want to endorse what our colleagues have said, but also to say, this argument that is very often made that, the state capacity is really weak, and, that's why we need to have, much greater private provision. I think, the private provision, there obviously always has to be some kind of a mix of the two. But in situations where that state capacity is really, really weak, is also situations where the state is not even able to regulate the kind of market rules and market provision to make sure that the provision does abide by certain key principles, that does include increasing numbers of people, that has sort of lends itself towards universalism, for example. So that lack of capacity really also means that the private-public model also works really badly. So building that state capacity is absolutely central, and I think this is something which is quite clear in all of our normative frameworks in social protection. It doesn't mean the state has to do everything, but it has to be, the state has to be the overseer of a kind of public-private mix that really meets the kind of normative standards and meets the kind of universal reach that and adequacy that are key to any social protection system. Thank you.
Thank you, Shahla. And we have another question from Laurent Sierro. Go ahead, Laurent.
A broader question. So in the different monitors, you gave us some estimates of how many people might be affected in the next month. Do you have a first consolidated figure about how many have already been affected by the different restrictions?
Perhaps Shahla?
Thank you for that question. I don't know the number offhand. I cannot provide that, but I will get back to you with the latest figures from the monitor that will be launched, I believe, sometime this week. So we'll get back to you with the numbers.
Okay, thank you. We have another question from Maya Plentz from The Shift.
Yes, thank you very much for taking my question. My question is for Mrs. Vrsavi, again, talking about how the private sector now comes into play, privatization of pensions. And you mentioned that you are going to have a meeting pretty soon with some government stakeholders as well as your social partners. When is this meeting scheduled to take place, and what is in the agenda, besides what you told us a little bit?
The meeting was scheduled to take place, if I'm not mistaken, on the 3rd to 5th of May, but because of the crisis, we had to cancel the meeting. And we're now still looking to dates, but we were hoping that we could have that meeting in the first week of December. So that's the date that we're looking towards, but obviously a lot will depend on restrictions that are likely to remain in place or not. So we'll just have to wait and see. And this is a meeting that is quite difficult to have remotely because of all the problems of interpretation, simultaneous interpretation that we're going to need. So yeah, so we're hoping that we could still have it in the first week of December. Thank you.
Thank you very much. We still have about 7 minutes, so if you do have some questions, just a reminder that we do have some experts here on the panel from Africa region, from Maputo, Mozambique, but also from New Delhi, India. Okay, Maya, you have another question. Go ahead.
Question for Mrs. Christina Berend is regarding the universal basic income issues, and how is it going to be discussed going forward, as we see that there is perhaps a greater need of looking into social protection in general through unemployment insurance. But then in some cases, we know that some jobs will never come back. Some people will not be absorbed into the market, into the job market, both in the developed world now and in the developing world. So what are your impressions? What's going to change?
Yes, thank you very much for that question. And indeed, I mean, universal basic income is at the moment discussed in various contexts, but also with various kind of ideas in mind. I mean, we have some of the proposals around universal basic income are really coming from a perspective of really ensuring the necessary need of income security for the broad population. But there are also other proposals of the table which are more looking like kind of reducing the size of the state, reducing the size of social expenditure. So I think we have to be a bit careful on kind of what exactly it is that we're discussing. But I mean, you're absolutely right. I mean, the issue of income security is really paramount. And actually in the ILO, the way we are looking at it, and actually this is not a new development. I mean, the ILO has been discussing about this for many years. And in fact, there is also even an international labor standard on that topic. It's not called universal basic income, but what we're talking about is a social protection floor, which is basically a basic level of social protection that really guarantees both a basic level of income security to everyone, but also access to healthcare. And I think in this crisis, it is more than ever very visible how important this is. What is very important about this concept is that we are really talking about something which is defined at the national level, because we know that the situation in countries is very different. So the actual solutions and the kind of schemes and programs which are in place might look in a very different way. I mean, in some countries, they might want to implement a universal basic income in the sense how it's being discussed. In other countries, they might more look at, for example, a combination of other programs. They might look at, or maybe start with something like a social pension for everyone, or start with a universal child benefit. So there are very different ways of dealing with it. I think from what is important from our perspective is really to unpack that discussion and be really clear what exactly we're talking about, because there is so much different concept in that discussion. So really ensuring that there is universal protection for everyone, independently of whether people are, someone is an employee or self-employed or in another form of employment or not employed, and also making, but also not limiting it only to the income dimension, because we know that we also need to have access to quality services, which is as important. And so it's really, I mean, we need to think about a combination of different kind of policies. There's no kind of one panacea in that solution. But we see that there is this growing interest in really making sure that we talk about universal social protection for everyone, universal social protection systems that include a very strong social protection floor that really can ensure that everyone has at least this basic level of coverage and this basic level of protection.
Okay. Yeah, I think there are just a couple more points to be made, and then we'll wrap up after that. I think Nino has a point as well, and Shachar. Go ahead.
Yep, my point is really complementing what Christina, and it's about a lot about context. And for instance, in this region, it's the discussion on UBI is still quite new, and what we saw in some countries, indeed, they went for some universal kind of measures like Singapore or territories like Hong Kong, but were temporary measures, very time specific and time bounded. Even Timor-Leste is discussing and probably going to implement one. But I think what we have been advocating, and actually has been for universal social protection, and good examples in the region are, for instance, again, going back to Thailand with the universal pension, or the discussions we have in universal child grant, because it's much easier in a moment like a crisis to do a top up. And for instance, what we have been advocating, that even when we think about the elderly and we think maybe they are not in economic terms those who are immediately affected, but if you have a system that can bring monies to households because you have a universal pensions, you are also reducing the burden of those who are in working age and are not able to produce that sort of income. And I saw it in my own country, in Portugal, during the not the financial crisis, but after the crisis with the debt crisis, when unemployment went up, one of the things that actually saved several households of almost, let's say, social bankrupt was actually the pension system, because it was the only source of income for families with children that lost, both adults lost their job, and it was the person receiving a pension was able to keep the family floating. And I think, I mean, in some countries, I understand the discussion is very relevant on the UBI, but in some regions, I think we need we are still a little bit far, and we need probably to focus in a comprehensive system and see what are the priorities and what is actually also affordable for the moment. Thank you.
Maybe just to add to what already Christina and Nuno have said, I think one useful sort of momentum that's coming out of some of this discussion around a universal basic income is the difficulties with having very narrowly targeted schemes, particularly in countries where you have the majority of the people who are very poor, and then you're trying to have a kind of triage, you know, trying to select the poorest of the poor with methods that we know are deeply problematic and exclude a lot of people who should have been included, you know, because we don't have the kind of, you know, perfect data that some of these methods demand, like these proxy means tests. So there is an opening, I think, in the debate, and we have heard the World Bank also talk about this, that there are limitations with targeting, and maybe we do need to move towards having categorical but universal benefits, for example, universal child benefits or universal social pensions. And I think if we get that consensus on that, I think that would be a really big move towards both the ILO social protection floor, which has both child benefits and pensions in it, guaranteeing income security for people throughout the life cycle, and the young and the old are the two ends of that life cycle. So I think it's a step in that direction. And also, I think in terms of our normative mandate, again, kind of it does move us towards more universal systems that reduce the problems with, you know, that exist with these targeting methods, the exclusions, the social tensions that arise because people don't understand why, you know, their neighbor is included, but they're not. So I think if we get that consensus on the need for these categorical universal benefits, I think that would have been a positive gain out of this rather bleak situation that we're in. Thank you.
Thank you. We just have one last question. Maya, I think this is a follow-up from you, yes?
No, thank you very much indeed. It was great to see all perspectives and the question of, you know, the basic social protection floor. So I appreciate very much. Thank you. No, that's all. That's good for me.
Okay, so it wasn't a follow-up. Okay, no worries. So I think that we'll wrap up there. And thank you very much for attending this press briefing. And I'll just go through the names again of our panelists. And you can, as I said, you can find it on our media advisory that I sent you. So thank you to Shahla Razavi, the Director of the Social Protection Department at the ILO, Christina Behrendt, who's Head of the Social Policy Unit of the Social Protection Department, Nuno Cunha, Senior Technical Specialist based in Bangkok, Ruben Vicente Andres, Social Protection Program Manager based in Maputo, Mozambique, Helmut Schwarzer, Specialist in Social Protection and Economic Development based in Mexico City, and Divya Verma, Program Officer in New Delhi office. And they are all available for interview after this briefing or in the days to come. And so you can always contact me, yard@ilo.org or newsroom@ilo.org. Thank you very much and have a good rest of the afternoon. Thank you. Bye-bye.